Hi, today we're going to be talking about respiration. So, when you're talking with a patient, it's important to use language that they understand when explaining information to them. Doing this will ensure greater understanding of assessment, diagnosis, and treatment. Respiration, in the simplest terms, means breathing in and out. Its primary purpose is to move air in and out of our lungs to ensure that our body takes in oxygen. Besides this, our respiratory system is also responsible for our voice and speech. Our respiratory tracts are made up of much more than one would realize, such as our nose and mouth, our trachea, which is commonly referred to as the windpipe, and the larynx, the lungs, and so much more. There are also many muscles our bodies use for respiration, including the diaphragm and the internal and external intercostal muscles. When you combine all of this, you have all of the pieces you need for the puzzle of respiration. When you breathe in, you take in air through the nose or the mouth, your oral and nasal cavities, and through your trachea into the lungs to provide the body with oxygen. Our diaphragm and external intercostals contract, allowing our lungs to expand. When we exhale, our external intercostals and diaphragm spring back into place and force the air out of our nose or mouth. The image I've included in this shows how our lungs and diaphragm work together during respiration. When we speak, we're using our larynx, which is commonly known as the voice box. This is the point where the upper and lower tracts of respiration system meet. The larynx has three pair of folds, including the vocal folds that sort of act as valves and can open and close the airway. During typical respiration, when we're just normally breathing, these valves stay open to let the air come and go freely as we breathe. But when we begin to talk, air leaves our lungs and the pressure causes the vocal folds to vibrate. And this is where our voice comes from. As the vocal folds vibrate, they open and close. And they're constantly on the move. So changing their position will allow us to produce different sounds. And like I mentioned earlier, just like it's important to speak to patients with language that they understand, it's also important to use proper terminology when speaking with a medical professional to ensure a correct diagnosis and treatment plan is put into place for our patients. You may go further in depth when speaking to a medical professional because of their assumed background of the knowledge. During the process of respiration, ventilation takes place, which is the process of moving in and air out of the airway and lungs. The purpose of this is to take oxygen into the lungs and release carbon dioxide from the body. The respiration system consists of an upper and lower portion. The upper respiratory tract includes the nasal and oral cavity, where the air is inhaled and exhaled, and the pharynx. The lower respiratory tract consists of the trachea, bronchi, bronchioles, alveoli, and the lungs. The trachea is divided into bronchi, which supply the lungs with air. The diaphragm and the external and internal intercostals are the primary muscles of respiration and play a very large role. The external intercostal muscles come in 11 pairs that contract and pull the rib cage upward and outward to expand the thoracic cavity, giving our lungs room to expand. The internal intercostals depress the rib cage and contract the thoracic cavity, therefore allowing us to push the air out. There are also accessory muscles of respiration that assist with inspiration and expiration that are needed when additional air is needed to be taken in, such as when we're exercising. The larynx consists of interlinked cartilages, membranes, and ligaments, muscles, and soft tissues. It has several jobs that include aiding in respiration, swallowing, airway protection, and phonation, which is how we talk. The larynx has three pair of folds that include the aryepiglottic folds, the false folds, and the true vocal folds. These act as a pressure valve. During respiration, these valves are open, but during phonation, the true vocal folds vibrate open and close to create pressure, which allows us to produce speech. The sound then travels through the vocal tract where it is modified and resonated, and then it exits via the oral or nasal cavity, depending on which sound is being produced. The vocal folds change their position and tension to allow us to change pitch, loudness, and resonance. Thank you so much. My works cited are included. All information was found from Voice Disorders, Scope of Theory and Practice book by Ferrand, and my image was found from using respiration in your research on eye motions, an article written by B. Farnsworth.